Have you ever had that feeling? You wake up, you know you're awake, you can hear things, see things maybe, but you're completely stuck. Can't move a muscle.
Oh, yeah. It sounds like something straight out of a horror movie, doesn't it?
Totally. But it's actually a real thing for surprisingly quite a few people. It's called sleep paralysis.
That's right. About, what, 8% of people might experience it at some point? It's not incredibly rare.
8%? Wow. So
Mhm.
what exactly is going on there? You're awake, but you can't move.
Basically, yes. It's this temporary loss of muscle control. It can happen just as you're falling asleep, or more commonly, maybe, as you're waking up.
Even though your mind feels like completely switched on.
Exactly. You're conscious, but the voluntary muscles, arms, legs, speech, they just won't respond. There's actually a medical term for it.
What's that?
It's called atonia, atonia.
Atonia, okay.
And what's really interesting is that this atonia, this muscle paralysis, it's actually a totally normal thing during one part of our sleep.
Normal.
Oh.
How is being paralyzed normal?
Well, during REM sleep, that's rapid eye movement sleep, when we have our most vivid dreams, our brain actively switches off most of our muscles.
Switches them off. Why?
Think about it. If you were dreaming you were, I don't know, running a race or fighting a dragon.
Right, you wouldn't want to actually start running or flailing around in bed.
Precisely. It's a safety mechanism. Atonia during REM sleep keeps us still, keeps us safe, stops us from, acting out those dreams and potentially hurting ourselves or others.
Okay, that makes a lot of sense. A protective paralysis during dreams. So how does that relate to sleep paralysis, the scary kind when you're awake?
Well, in sleep paralysis, that state of atonia, it happens, or rather persists, outside of the normal REM sleep window.
So the timing is off.
Kind of. You might be starting to wake up, your brain is becoming conscious, but the signals telling your muscles to stay relaxed, that atonia, it hasn't quite switched off yet.
So your mind wakes up before your body does, in a way.
That's a good way to put it. The brain's awake, but the off switch for the muscles is still, well, it's still flicked on for a short while. There's a lag.
Okay, I'm starting to get the picture. Mind awake, body asleep. That alone sounds pretty unsettling. But I've heard it can get even weirder.
Yes, unfortunately. Many people experiencing sleep paralysis also report hallucinations, which obviously makes the whole thing much more frightening.
Hallucinations. What kind are we talking about?
There are a few common themes. One is the feeling of an out-of-body experience.
Out of body, like floating.
Exactly. People might feel like they're hovering above their bed, maybe looking down at their own body, sometimes even a sensation of flying around the room.
Wow. That must be incredibly disorienting, especially when you can't move.
Definitely. Another very common one is a feeling of pressure, often on the chest.
Pressure. Like something's sitting on you.
Yes, exactly that. A heavy weight pressing down, making it feel hard to breathe, which of course adds to the panic.
I can imagine. Can't move, feel like you can't breathe. And then there's perhaps the most disturbing type for many people,
Which is?
the sense of a presence. Feeling like there's someone or something dangerous in the room with you. A malevolent presence, sometimes even seeing a figure or hearing footsteps or voices when nothing's there, combined with the paralysis, it's understandably terrifying.
Yeah, no kidding.
Right.
Paralysis plus a perceived threat. That explains why it's often described in such horrific terms. So why does this happen to some people and not others? Are there, triggers?
There are definitely contributing factors we know about. Probably the biggest one is poor sleep habits.
Like not getting enough sleep.
That or having a really inconsistent schedule, going to bed and waking up at wildly different times,
Hmm.
jet lag, shift work. Anything that messes with your internal clock can increase the risk. So disrupted sleep is a key factor. Anything else?
Yeah, there's also a known link with certain other conditions, things like sleep apnea.
Where you stop breathing periodically during sleep.
Right. Also PTSD, post-traumatic stress disorder, and general insomnia, just difficulty falling or staying asleep. It seems like anything that disrupts sleep quality can potentially open the door.
Makes sense. It sounds like our sleep system is quite delicate.
It really is. And interestingly, there also seems to be a higher likelihood in people dealing with anxiety, depression, or bipolar disorder.
So mental health plays a role too.
It appears so. The connection isn't fully understood. Maybe it relates to stress hormones or neurotransmitter imbalances that affect both mood and sleep regulation. But the correlation is there.
That's fascinating. And what about age? Does it hit certain people more often?
It can happen at any age, really, but the first episode often occurs during the teenage years.
Oh, really? Like 14 to 17?
Yeah, that seems to be a common window for it to start showing up. Though, of course, it can start later or even earlier, but adolescence is a frequent starting point.
And for some people, it just happens once or twice, right? But for others,
Yeah.
it keeps happening.
Exactly. We make a distinction there. There's isolated sleep paralysis, which might just be a one-off or very infrequent event, maybe triggered by extreme sleep deprivation or stress.
Okay.
And then there's recurrent sleep paralysis, where it happens more regularly. And if it's recurrent, that's usually when you'd want to look into it more serially.
Right. So if you are experiencing this, especially if it's happening often, what should you do?
First step, definitely, is talk to a healthcare professional, your GP, or maybe even a sleep specialist.
Why? Just to get it checked out.
Well, partly to rule out other things. They'll want to understand what's going on and make sure it's not a symptom of, say, narcolepsy or another underlying issue. Mostly they'll start by asking about your sleep.
Your habits, routines,
Yeah,
that sort of thing.
exactly. They might even ask you to keep a sleep diary for a couple of weeks.
A sleep diary, like writing down when you sleep, wake up, any episodes.
Precisely. It helps track patterns. When are the episodes happening? How much sleep are you getting? Are there obvious triggers? It gives valuable clues.
What if that's not enough?
In some cases, particularly if they suspect something like sleep apnea, they might recommend a sleep study.
Ah, where you go and sleep overnight in a lab.
Yes, polysomnography. They hook you up to sensors and monitor your brain waves, eye movements, muscle activity, breathing, heart rate, the works. It gives a very detailed picture of your sleep architecture.
Okay. So let's say you've seen a doctor, maybe kept a diary. What's the actual treatment? Is there a cure?
Well, there's no magic pill cure, usually. Treatment almost always focuses heavily on improving sleep hygiene, those sleep habits we talked about.
Getting back to basics.
Absolutely. That's often the most effective approach. Sometimes, if there's significant anxiety or depression contributing, medication for those conditions might be considered, as treating the underlying issue can help. But the lifestyle changes are key.
What kind of changes specifically?
The standard good sleep advice, really, but it's crucial here. Things like avoiding blue light from screens, phones, tablets, computers for an hour or two before bed.
Because that messes with melatonin, right?
Exactly. Also, making sure your bedroom is cool, dark, and quiet. Sticking to a really consistent sleep schedule, even on weekends, that helps regulate your body clock.
Consistency is important.
Very. And avoiding caffeine, especially later in the day. Maybe alcohol too close to bedtime. Basically, giving your body the best possible chance to have regular, uninterrupted sleep.
It sounds like good advice for everyone, honestly, not just people with sleep paralysis.
It really is. Healthy sleep is fundamental. Now, going back to the mechanism for a second.
Yeah.
You mentioned the paralysis during REM involves chemicals.
Yes. Can we touch on that again? What's happening chemically?
Sure. So research points to two main neurotransmitters,
Yeah.
glycine and GABA. During REM sleep, these chemicals become quite active in certain parts of the brainstem.
Glycine and GABA. And what do?
They essentially act like inhibitors. They dampen down the activity of the motor neurons, the nerve cells that tell your muscles to move. It's like they're flipping the off switch for muscle activity.
Okay, so they actively suppress movement during dreams.
Right. And in sleep paralysis, the idea is that as you transition out of REM or into wakefulness, the levels of glycine and GABA might still be high enough, or the motor neurons might still be inhibited.
Even though your conscious brain is coming online.
Precisely. So the off switch is still engaged, even though your awareness has returned. That's the temporary paralysis. It's a biological process that's just slightly mistimed.
Okay, understanding that chemical basis actually makes it sound, well, less supernatural or mystical, even if it feels terrifying at the time.
Absolutely. Knowing there's a physiological reason can sometimes help reduce the fear associated with it. It's your own body's mechanisms slightly out of sync, not some external force.
So, wrapping up, what's the main takeaway for anyone listening who thinks they might be experiencing this or knows someone who is?
I think the key message is, while it can be genuinely frightening, sleep paralysis is a known phenomenon. It has biological roots, and importantly, it can usually be managed.
It's not necessarily dangerous in itself.
Generally, no. The experience is scary, but the paralysis itself isn't harmful. The focus should be on improving sleep and reducing the frequency. And, crucially, don't just suffer in silence.
Talk about it.
Yes, talk to a trusted adult, a friend, a family member, and definitely consult a healthcare professional. They can help figure out what's going on, offer strategies, and just provide reassurance, which can make a huge difference to your well-being. Getting help is the right move.